as opposed to the office hours that we've been working to keep more of an open-ended conversational meeting. So this is the structured meeting, and I see that we've turned on, thank you, Kyla, we've turned on the recording. This one will be recorded. If that's, if you object to that, you can listen to the recording later. Otherwise, we'll record it and send out the link with the PowerPoint, which includes a lot of information, in the next couple days. So thank you for joining us. Today's presentation will include some information on support you can obtain from our mental health partners, some information on the vaccines that we have available for COVID, and then Elena will do the updates on Omicron and COVID in general, and then our partners, CCAP, ECCBC, will give us some updates. And I always list our Healthy CE COVID at bouldercounty.org for any questions regarding COVID. So I'll turn it over to Bethany, and I'll mute myself.
Thank you, Jane. My name is Beth Garrett Myers, and I'm the supervisor for the Kid Connects program with Mental Health Partners. And I asked Jane to join just so that we could give you an update on how we can support those daycare centers and home care providers that have been impacted by the wildfires. I don't know if Jane, if you can move to the next slide really quick. So here's just some of the ways in which we can help in this time of need. One of the ways is resource development. I'm sure that many of you guys have received our handouts on how to talk to children about the wildfires or how to talk to them about the damage that they see from the wildfires. We can do more of this if you guys need that. We have found that in the past around events like this, this is a really easy way to get you guys the education and tips that you need to support your children and families. Another way we can help is through referrals. So if you are working with families that have been impacted by the fires, we can link them to long-term therapy resources or other resources in the community that might be of help. We do have some funds for material goods. So if your center is in need of any items that promote social emotional learning, such as books, we have a great book list around, when we're scared or different kind of disasters. We can purchase those for you, or any items that you might need for your cozy corners. We are also willing to offer reflective groups. So we know that not only are the families that you're serving been impacted by the wildfires, but your staff and you yourself. And so we can come and facilitate conversations about, how do we support ourselves and how do we make space so that we can really address the needs of our classroom, and what are those needs and how might they shift in response to this event. Lastly, we can offer child and family specific consultation. So brief consultation regarding a concern for a child or family member. So these are just some ideas, but we just really want to hear from you in terms of what you need. You know your community the best, and if you have an idea or something that you're hearing from family members or staff members, please reach out. We can be really creative and flexible in how we respond to those requests. So I included in the slide our email, which you can email us, or you can always call our warm line. That number is listed there. So I know that was pretty brief, but I just want to reiterate that we're here for you, and what you guys are offering to these kids as they navigate this horrible event is just so valuable. You really are a home away from home for these children, and we just want to be there to support you in whatever way possible.
Thank you, Beth. And I had a couple questions along the way, so I just want to reiterate that your support is available for families as well as staff and children. That was some of the questions, that could they use the warm line for family support as well? And the answer is yes, correct.
Yes. And I would say, when in doubt, give us a call. If you have, again, a question or a concern, please err on the side of caution and give us a call, and we will definitely be able to, if we can't provide that support, we can hopefully guide you to who can provide that support. But yes, we're here for you, we're here for your staff, and we're here for the families that you serve.
Thank you. Thank you, Beth. I know that's going to be well appreciated. So I know you have to run, and if people have questions and they put them in chat and we can't answer them, I will forward them to you.
Okay, wonderful. Thank you so much.
Thank you.
Bye.
Bye. And now we have Penny giving us an update on COVID vaccines.
Hi everyone, I apologize, my camera hasn't been working. There should be, I thought, one more slide in there, Jean.
Yep.
All right, there we go. So as you all know, boosters are in high demand and can be somewhat challenging to access right now. I have linked a list of Boulder County providers there in the chat. BCPH has clinics at the St. Vrain Community Hub on Thursday, Friday, and Saturday this week, and then we will be back on February 1st on Tuesdays and Thursdays from 3 o'clock to 7 o'clock. We, as of this morning, this other point has changed. The mass vaccination clinics at the Boulder County Fairgrounds in Longmont are up and running as of today. Those links are also linked on that provider webpage. There are a ton of openings over the next couple of weeks. They're taking something like 240 people a day, and for all ages 5 and up. And then just recently, boosters were approved for everyone 12 and older. And that would be for Pfizer, since that's the only one approved for minors. The minimum spacing for boosters for both Moderna and Pfizer has recently changed from 6 months to 5 months. Boosters are also approved for kiddos that are 5 to 11 that are moderately to severely immunocompromised. And then Johnson & Johnson is not recommended by the CDC anymore. It's still available. Some practices may choose not to carry it. BCPH does have it. We'll keep a small amount on hand for those people that are just really adamant that they get the J&J. But your best bet for a booster or the primary series is an mRNA vaccine. I think that's all I have. Thank you.
Thank you. And Penny, if there's questions, can you stick around for a little bit?
Sure.
Thank you. I'll turn it over to Elena.
Thanks, Jane. Hi, everyone. I just wanted to start this off by really thanking each and every one of you for coming today to listen. I know many of you are dealing with unprecedented volumes of staff and child cases at your facilities right now, so I really appreciate you taking this time out of your day to join this space. We're going to be doing a very brief case data update, and you'll see why that's brief very shortly. And then we're going to spend the bulk of our update today reviewing our new quarantine and isolation policies for childcare providers in Boulder County. And I'll wrap this up with a couple slides that have explicit talking points that you may be able to include in any correspondences with your parents in the coming days and weeks. I know there's been a big request for that. Okay, so let's get started.
Thank you.
Okay, so this graph I think really speaks for itself. COVID-19 is at a record high right now in Boulder County, statewide, and nationwide. So this graph depicts the 7-day rate of new cases of COVID-19 per 100,000 population. Focusing first on the yellow, orange, and red lines down the bottom, the red line is where the CDC has set their threshold for high community transmission, and that threshold is 100 cases per 100,000 population or higher. So that's the context for what high community transmission is, 100 cases or higher per 100,000 population. At the latest update for Boulder County data, we are at 914 cases per 100,000 population, so substantially over the threshold for high community transmission. I've included arrows just for reference to indicate where our case rates were when we met last month, as well as this time last year. And honestly, this case estimate of about 914 cases per 100,000 population is likely an underestimate because this does not include anyone who's tested positive using an at-home test. So the true rate of cases in Boulder County is likely to be higher than this, but this only includes those tests done through our laboratory or community testing site. I do not have a slide on hospitalizations. We are seeing a slight uptick in hospitalizations already. However, hospitalization data tends to lag rises in case data by about 2 to 3 weeks. So we will continue to keep a really close eye on hospitalization data in the coming weeks. Okay, and this graph represents our current estimates for percent positivity. As of January 3rd, our percent positivity was a little over 20%. So that means in Boulder County at that time, about 1 in 5 tests being collected at either a community test site or a healthcare provider were coming back positive. So to reiterate, about a week ago, 1 in 5 tests were coming back positive in Boulder County. Statewide positivity is even higher, and it's at about 1 in 4 tests. Accordingly, this does not include anyone who's getting tested on an at-home test. So these are just folks presenting to community test sites or to a healthcare provider. And just like it was for case rates, this is an all-time high for both Boulder County and the state. And frankly, is one of the reasons that we've been saying in our office hours, if you've got someone with symptoms, it's very likely that they have COVID because right now a minimum of 1 in 4 tests are coming back positive. Okay, I debated including the slide, to be honest, because my team is really prioritizing our immediate disease control support for you all rather than data. So this graph is depicting the number of staff and child cases associated with a Boulder County child care facility. All the way to the right depicts the most recent weeks of data, but I fully expect these columns to at least double, triple in volume, if not more, as my team finds some time to enter more of the case reports that you're sending in. But I'd say the big takeaway here is that the rapid rise that we're seeing in community cases is what we're also seeing in childcare settings. And we are seeing a growing proportion of cases that you all are reporting to us be in staff members. Whereas prior to late December, we were seeing mostly child cases and a smaller proportion of staff cases. I will say, we don't have a immediate explanation for this. It could be a bit of an artifact, especially for facilities that had closed for a number of weeks. It's possible that maybe parents weren't reporting all the child cases because they knew they, would be done with isolation before coming back. Or this could reflect a true rise in spread among staff. We just don't quite know, but this is what the data is shaping up to look like for the time being. Okay, so now we're going to go ahead and dive into our updated quarantine and isolation protocols. I know a number of you have been attending office hours, particularly over the last week, where we have talked pretty in depth about these updated quarantine and isolation protocols. I will point out that there have been 1 or 2 additional changes made since last time we met. I'll be sure to point those out. But yeah, thank you all in advance for your patience with these ever-changing protocols and policies. So we're going to start with quarantine. And just as a reminder, quarantine is the phrase that we use specifically when somebody has been exposed to a person with COVID-19. They need to stay home away from others until they determine if they've been infected yet themselves. Quarantine is that period when we're questioning. We've been exposed, but are we going to develop COVID ourselves? Okay, so with that context in mind, the most substantial change, I would argue, that we've kind of been forced to make is that Boulder County Public Health is no longer requiring quarantine after most exposures in childcare settings. And while this may seem counterintuitive upfront, the main reasoning behind this is that as exposures to COVID-19 become so widespread in the community, it reduces the effectiveness of some of the public health tools that we were using in the past, such as quarantine. So in other words, we really do not believe that contact tracing and quarantine can keep up with the spread of Omicron, and it really wouldn't have the same degree of disease control effectiveness that we had seen in the past. So when you have exposures in your childcare settings, we will not require quarantine. Please do, and you all continue to be required to report all cases to us. And so all cases, staff and children, even if they weren't present while infectious. Our team will do our best to keep up and provide exposure notification letters that you can send out to parents when their child has been exposed at care. But again, that language has been modified to make it clear that quarantine is not required. We just want them to monitor for symptoms and get tested on or after day 5 if possible. So to that point, we are still recommending testing on or after day 5. But again, as long as they are symptom-free, they can continue attending care even if they've been exposed at childcare or school, and they do not have to be excluded while they're waiting on a test for day 5. They'd only have to be excluded once they've tested positive or developed symptoms. Now, we want to be clear that while we are not requiring quarantine for exposures that happen in childcare settings, we are going to continue to require quarantine for some individuals that are exposed in the household. And the short explanation behind this is that with Omicron, we are seeing nearly complete spread in households, meaning that if someone in the household has COVID-19, it's very, very unlikely that the rest of the household members will be spared. So that's why we really want to try to exclude those that have been exposed from a household contact and focus less on exposures happening in childcare. So with that said, unvaccinated and undervaccinated staff and children must continue to quarantine after exposure in the household. And in the next slide, we'll take a look at what undervaccinated means, since that's kind of a new phrase that we've incorporated into our guidance. I will point out this is one change here highlighted in yellow that was something that we were advising differently up until the 7th on. So we are going to have to follow the CDC policies here, but when someone is exposed and exposure is happening at home, we are going to count day 5 of the case's isolation period as day 0 for the start of contact's quarantine, if that contact is going to continue to have, be around that positive household member. Originally, we were saying we were going to still wait until day 10 because people theoretically can still be infectious day 6, 7, 8, 9, 10. But this is kind of a battle that we lost. So moving forward, please continue to connect with us when you have people that have been exposed in the household, and we can provide these timelines for you. Okay, so this table is a summary of our quarantine protocols, and they are pretty much the same for children and staff. So for those, again, that have exposed in the childcare setting, they can continue to work if they're symptom-free, test on day 5 if possible, and only if they develop symptoms or test positive do they need to isolate and stay home. And again, exposure to COVID-19 in the household setting, we want you to quarantine at home for 5 days after exposure if you are not exempt from quarantine. Right, that's actually on the next slide. I promise we'll get to it. So if you are not exempt from quarantine and you've got a household positive, got to stay home for 5 days after exposure. You can return on day 6 if you're symptom-free, haven't tested positive, as long as you can keep wearing a mask around others on day 6, 7, 8, 9, 10. And the reason behind that is even though the CDC has shortened the length of quarantine and isolation, People with COVID-19 can continue to be positive on day 6, 7, can continue to be contagious to others on days 6, 7, 8, 9, 10. They might not be as contagious as they were in that first 5 days, but there can still be residual shedding of active virus. So that is why that masking piece is pretty critical here. So if someone has a household exposure, is under the age of 2, or has a masking exemption, we are going to keep them out for a full 10-day quarantine period because they aren't able to wear a mask to help negate that lingering risk of spread. Okay. As I've mentioned, some individuals are quarantine exempt due to vaccination or prior infection. Those conditions for quarantine exemptions have changed as well. So we'll go ahead and review those on the next slide now. Okay, so I phrase these in 2 different ways, both who must quarantine and who does not need to quarantine, just because it can be a lot to wrap our head around. So hopefully these 2 ways that it's presented make sense. So who must quarantine after household exposure? So we're looking at staff or children who have not been vaccinated at all and have not had a recent COVID infection. Somebody who needs a quarantine would be staff or children who received their 2nd dose of Pfizer Moderna more than 6 months ago and have not received a booster and have not had a recent infection. Or staff or children, well, I guess just staff on this one because children aren't eligible, but just staff who have received a single dose of J&J more than 2 months ago, have not had a booster, and have not had a recent infection. And for the purpose of this guidance, recent infection is a positive COVID-19 test within the past 90 days on or after December 19th. I do want to point out this December 19th threshold is something unique to Boulder County policy. Technically, the CDC and CDPHE are still saying, you know, positive test within the last 90 days, regardless, is sufficient. However, it is still not clear how much protection somebody who was infected under the Delta variant would have against the Omicron variant. And anecdotally, we've already had a few individuals that have developed a new COVID infection within 60 days, you know, both the Delta and the Omicron period. And we've heard from pediatricians in the state that they're seeing families who have tested positive for COVID over Thanksgiving and then again over Christmas. So we just want to be a little bit more protective here at Boulder County and are using that date of December 19th as a cutoff because that's when we feel relatively confident that that is probably when Omicron was the dominant variant in Boulder County. So people testing positive on or after December 19th were very likely to be an Omicron infection. I'm not done with the slide, but I'm going to take a quick pause. It's a lot to work through here. Okay, so we're going to kind of flip the language and now just reiterate who does not need a quarantine after a household exposure. So this one's a little bit more straightforward when you look at it this way. You do not need a quarantine if you're a staff or child who has received a COVID-19 booster, point blank. We don't need to wait 14 days. As soon as you have that booster, you are exempt from quarantine. Staff who received the single J&J vaccine within the last 2 months, quarantine exempt. Staff or children who received the 2nd dose of Pfizer or Moderna within the last 6 months, also quarantine exempt. And then finally, vaccinated or unvaccinated, doesn't matter, but if you've had a COVID-19 infection on or after December 19th, then you are also quarantine exempt. Okay, so that is it for quarantine. So now we're going to go ahead and talk about our new isolation protocols. So as a reminder, isolation is the phrase we use when somebody who is known or suspected to be ill with COVID-19 stays home and away from others for a period of time until they are no longer contagious to others. Isolation, again, very specific to those that we know have illness, we know they're infected. Okay, so with that context in mind, we have gone ahead and adopted shortened isolation timelines for ECE staff under the condition of strict masking adherence. So we'll look at that in a little bit more detail. But again, just for context, we've adopted the shortened isolation periods that the CDC provided for the general population for staff who can mask to a certain degree of conditions, really to help alleviate shorting or staffing shortages that you all are currently facing or will be facing in the coming days or week. Today, as of the 10th, we are still holding the line and keeping isolation for children at 10 days. And that is because the CDC really stressed to us that in order to be eligible for shortened quarantine of 5 days, we really need to continue wearing a mask to, again, negate that risk associated with residual shedding of virus on days 6, 7, 8, 9, 10. We did kind of compromise here with our policy teams, and we are going to allow isolation for children to be shortened by January 17th. So that's about a week away. We're hoping that by that point we'll be nearing our peak and maybe hoping to see our surge start to stabilize or decrease by that time. And this would apply to children under 2. And so we'll look at this in the next slide, but that is going to be shortened to 7 days from 10 for all kids in childcare settings, regardless of mask use. And if you are a facility that wants to start implementing the 7-day isolation before the 17th, you are welcome to do so. Okay, so here we get into the nitty-gritty details. So unlike the quarantine changes, there are different timelines for isolation if you are a child or if you're staff. So first we'll start with what we're looking for children. And here we're really looking for those that are younger than kindergarten. So children that are not school-aged. We've been saying roughly 0 to 5. We're more interested in the ages of who's in their class rather than that kid themselves. Because I know we're at that time of year where we've got some kids that are 5, and we just want to make it clear that if this is a class that is younger than kindergarten, we're sticking with the child column. And then the staff or school-aged column can be used for those that are kindergarten aged or older, again, in a setting where their peers are kindergarten or school-aged as well. Okay, so with that said, for the child column. So any child that has a positive COVID-19 test or symptoms after a known exposure are going to be required to isolate at home. So they are isolating at home for 10 days, returning on day 11 if fever-free for 24 hours without the use of medication and other symptoms have improved. And again, we have additional language here about the 17th. So by the 17th, we're looking for all childcare providers to drop this down to 7-day isolation, returning on day 8. And we'll be sure to update all of our written guidance to reflect that on the 17th. But you can go ahead and implement that shortened isolation sooner if you would like. For staff and children in a cohort, kindergarten aged or older, we're looking for a 5-day home isolation period. And if they are symptom-free or symptoms are improving and they are fever-free, they can return on day 6 as long as they wear a mask around others at all times. So here is where we're really going to get strict with this masking condition. So anytime they need to remove their mask, we're looking at needing them to be like at least 12 feet away from others. So for staff, this would be eating lunch or, taking a drink completely away from everyone else. And so logistically, if this individual cannot be wearing a mask at all times when around other people during their day, then they do need to stay out and do a full 10-day home isolation period. As a reminder, a negative COVID test following a positive test does not allow an individual to end isolation early. We do not treat those as false positives. For a number of reasons, it is not unlikely to receive a negative test after you've testing positive. And again, it does not mean that that first test was a false positive. We need to defer to that positive test, complete isolation, and nothing can change that in terms of retesting. Okay, so again, I know there was a lot of ask, especially at office hours, about communications for parents. And right now, our formal communications from BCPH, those resources are really being allocated to the fire response. And we're fortunate enough to get communications to put a letter together for parents about a week and a half ago, but we're just not in a position to really provide, updated letters to parents, as we move through this incredible surge. So because of that, I have included the next 3 slides that have talking points that you are welcome to incorporate into your communications with parents that are, very straightforward and hopefully quite clear about these recent changes. Looks like we still have a decent amount of time, so I will go through and just read all of these out loud, but we'll try to get these slides to you as soon as possible so you can, start using some of this language in your communications if you would like. So the key takeaways or the key messages for parents in terms of community transmission. Rates of COVID-19 are at a record high in Boulder County and statewide. Between 1 in 4 and 1 in 5 COVID-19 tests collected in Colorado and Boulder County respectively are positive. The Omicron variant spreads more rapidly and easily than previous forms of the SARS-CoV-2 virus. We expect cases to continue to rise rapidly in the coming weeks, and exposures in the community, including those in childcare and school settings, are expected to become very common. Children may become exposed to COVID-19 at childcare, and parents need to keep at-risk individuals in their household safe and have a plan with their healthcare provider if infections do occur in that household. Children with complex chronic, cardiac, and congenital conditions have the highest risk of developing severe illness from COVID-19. And children with other conditions such as obesity, asthma, and diabetes are also at heightened risk. And unfortunately, healthy children with no underlying conditions are susceptible to developing MIS-C. So Boulder County has released updated isolation and quarantine requirements for childcare providers, as you all know, in order to address these changing conditions. But childcare providers may implement facility level policies that are more strict than BCPH guidance. And this is a hyperlink here in this bullet number 6. So, if parents want to see all of the isolation and quarantine timelines and requirements, those are all there founded under our detailed guidance page within that hyperlink. Okay. And then provided some, key messages to parents regarding quarantine. Again, we've already covered a lot of this, but I'll just go through it for you all. So quarantines in childcare settings for routine exposures are not anticipated. We may quarantine an entire cohort if there is, or if we anticipate there might be an outbreak, and we believe that quarantine would be effective at that point. My team is absolutely trying to keep up, but parents may not be notified of all exposures, or exposure notifications may be delayed. And then again, as described in our detailed school and childcare guidance, unvaccinated and undervaccinated children and staff with a household member with confirmed COVID-19 must remain home and in quarantine. And then I also included language about when day 0 of a contact's quarantine starts in regards to that positive household member's isolation. And hopefully that will negate any arguments you might have from parents about when their kid has to start quarantine. And finally, Boulder County does strongly recommend, although it's not required by us, that unvaccinated students and staff who have a household member with symptoms of COVID-19, but no positive result, stay home in quarantine. But again, childcare providers may choose to require this as facility level policy. Okay, and finally, some key messages for parents around isolation. So anybody with symptoms of COVID-19, even mild, should isolate and get tested. All symptomatic staff and children must remain out of school or work until their symptoms improve and they meet return to learn and other illness policies. Only healthy, non-ill students and staff will be permitted to attend school or work. All staff and students with a positive COVID-19 test must remain home in isolation, regardless of their vaccination status or if they have symptoms. And again, a subsequent negative test will not end isolation early. Staff and students who develop symptoms of COVID-19 after a known exposure will be required to isolate regardless of vaccination status. And that's just simply because we really don't have time for people to get tested and wait for those test results. So if they're exposed, symptomatic, we're treating them as a COVID case and keeping them in isolation. And then again, as described in our detailed school and childcare guidance, childcare staff who can follow those strict masking requirements and are symptom-free or have symptom improvement are able to end isolation earlier than children in order to ease the imminent staffing shortages. Okay, and lastly, just a reminder that all child care providers, including family child care homes and licensed and license exempt settings, are required by Public Health Order 2021-07 to email us at health-ece-covid every time a staff or child associated with your facility has tested positive, even if they weren't present while infectious. We do monitor the inbox about 8 a.m. to 5 p.m. Monday through Friday. Please expect delays due to heavy volume, and we are prioritizing responses based on urgency, but we do work through this rapidly to get back to everybody as soon as possible. And one final ask, please do not call or email Jane Wilkinson, Kara Kaiser with any COVID-related questions, concerns. Everything COVID-related must go through Health ECE COVID. And please also do not email my personal account, A Younger Boulder County, because I don't monitor that inbox as frequently as Health ECE gets monitored. So just to reiterate, Health ECE COVID at bouldercounty.org for all COVID-related questions, concerns, and case reporting. All right, so that's it for me. I'm sure we're gonna have a lot of questions to work through, but thank you all for your patience. This was a lot to process, so I appreciate all of you.
Thank you, Elaine. I'll just remind you to go ahead and put information in the chat, and we'll get to that. So we'll do some partner updates and then look at the questions in our chat. Is anyone available? Jody from CCAP would like to give us an update.
I would love to. Yes, thank you. Can you hear me?
Yeah.
Great. Thanks for having me. I think I just want to start by saying how much I'm getting an echo, first of all, but secondly, how grateful I am for all the collaborations. I had the privilege of working with Kid Connects with some families in a past role, and just can't say enough good about them. So please reach out to Bethany and her team if you need to. I also spent some time at the Disaster Assistance Center, which, as you can imagine, is pretty chaotic, but wanted to share that resource with you all. That's for anyone affected by the fire. There's Insurance Village out there, there's FEMA, there's lots of good help for the community. Finally, my information I'm going to just throw in there. That was just so much to process. I'm so impressed by Elena and her team. I'm just for presenting that in such a graceful, calm way, and really it's dire situation. So thank you all. Here's my information for any CCAP questions that you may have. Thank you all.
Thank you, Jody. Thanks for bringing up the DAC. That's really helpful. And I think Amy Carlo from ECCBC, the Early Childhood Council, Boulder County.
Hi everyone. Again, want to echo what Jody said. Thank you for all of this incredible information. We here at the Early Childhood Council, Boulder County, we have a child care resource and referral Marshall Fire child care response team set up. Our goal is to support every provider in Louisville and Superior with extra individual support over the next few months. We're gathering information right now to see how we can best support those centers that are really affected by this crisis. And please know that we're here for you. We're here when you need us, and we will be connecting with those centers weekly and really seeing how we can be of best support. So hopefully those of you that are in that area have received calls from us, and please reach out anytime. Thank you.
Thank you, Amy. Bethany had already presented on the mental health partners, so if you need any assistance, please reach out to her. If you have lost track of her email, I'll include it with the notes. But that group is very much available for families and staff and children. The next meeting is going to be on Valentine's Day, February 14th. I'll send out a link with these minutes, and I just want to remind everyone on the call that I've put the office hours that Elena has created in a document that's attached to these emails, so that you can forward that, use that, but I'll send I'll add that link for the February 14th meeting to the notes for this meeting. And thank you for bringing up. It's so much more efficient and quicker when you use the Healthy CE COVID at Boulder County versus trying to enlist others, because Kara and I are really always willing and able to help, but we're not keeping up with COVID either. So we leave it to the experts, Elena and her team. So I dropped the PowerPoint, and Kara's been watching chat, and I know Elena has as well. So I'll leave it up to the two of you to monitor the questions. I'll turn it over to that. Thank you.
Thanks. Thanks, Jane. So Elena, I'm not sure if you want me to read or if you've been kind of watching them.
Yes, I appreciate that. I've been watching them. I'm happy to kind of read them myself and read them out loud. Before then, I do just want to expand on what Jane said about office hours. So for this week, I have 2 sessions scheduled. One tomorrow, Tuesday the 11th, from 4 to 5 p.m. and then one on Friday, I believe that's the 14th, from noon to 1. So those, again, are unstructured sessions where you can drop in, bring your questions, concerns, and we'll walk through them then. Okay. All right. So first question from the presentation. For children that, so this is from Andrea S. So for children that were exposed, I guess children or staff that were exposed at school or childcare, do they have to stay out until test results come in on day 5? No. So as long as they are healthy, symptom-free, staff and children can continue attending childcare or school after a school or childcare exposure. We recommend testing on day 5, but we do not require them to be out while test results are pending. There's a follow-up question, but I'm not exactly sure what the ask is there. So Andrea, if you're able to rephrase that and put it in the chat again, I'm happy to address, or if that's something that's best answered one-on-one over email, we can do that as well.
We had this situation at our school, and then day 5 was on Saturday, and then 2 children didn't have their PCR results back. One of them came to school today, and they were there for like a half an hour, and then their PCR came back positive. So basically, we feel like we exposed a whole nother, like we opened up a whole new pocket of exposure. And so I said I would follow up with that question and ask, and we'll just have to figure out how we want to handle it in the future. But thanks.
Yeah. Okay. Thank you for clarifying that. And yes, right now with this current state of test availability, both the difficulty and concerns around sensitivity about antigen testing and challenges with getting PCR testing at community sites, that is why BCPH as an agency has not made a requirement for testing on day 5. But again, as a facility, you are welcome to make that your own policy if that feels most reassuring to you. Okay, is there a mandate? So moving on to Amy O. Is there a mandate that we must provide staff N95s if they are returning after a 5-day quarantine? So there is not a mandate or requirement from BCPH regarding what kind of mask is worn. To be in alignment with PHO 2021-07, they need to be well-fitted masks. And if they're cloth, they need to be at least 2 layers. I do believe the CDC still recommends saving N95s for healthcare providers, but KN95s are available commercially. I know we were helping support some facilities with getting KN95s to you, but I think we are running low. So if we are able to come into a larger supply of KN95s, we'll certainly communicate with you all and let you know. But those are available for purchase commercially, including on Amazon. Not a plug, just saying that I have seen some of them available online. Okay. Okay, so Elizabeth F. If a teacher has been determined positive for COVID and is unboosted, how soon can they be boosted? Great question. So from a disease control side, we just want them to finish their home isolation period before leaving to get boosted. However, whoever is providing that booster may have additional restrictions or preferences. So from disease control, I would say complete isolation, and then recommendation would be get in contact with the vaccine provider to see if there is a different timeline from them. And if anyone from BCPH wants to jump in and clarify if there's any additional conditions from BCPH vaccine clinics, please feel free to do so. Okay, so I'll continue on then. If a question from Philly B. If a cohort has a spike in cases, more than 5 separate households, are we not closing the classroom? So here Philly is referring to the threshold for a confirmed COVID-19 outbreak, which is typically 5 or more cases from at least 5 different households with onsets within a 14-day period. And the answer is no. We are seeing rapid rise in cases in childcare facilities. Many of you are already well into the double digits of cases within just a couple days. So we are not putting a mandate across the board and saying, when you hit this threshold, you need to close. We are not doing that. We want you to try to continue to stay open, provide this vital service to both our children and, Boulder County families. If you get to that point where you can no longer safely operate due to staffing shortages, that's when we would expect you all to make a facility level decision to close because you can no longer safely operate. We do retain the authority to recommend facility-wide closures or classroom closures, but the straightforward reality is right now, I think those would be quite limited in terms of effectiveness. With so many people having COVID in the community right now, if we were to recommend a closure, for whatever length of time that might be, the second you open right back up, there's probably going to be another exposure and rapid spread within, coming from another source. So we will continue to report outbreaks, but that is on the back burner. So there is a good chance that those of you that have had more than 5 cases or are starting to accumulate those cases, there's a good chance we will circle back with you in the coming weeks to get some documentation and information for reporting. But right now, disease control, immediate support is the priority, and then outbreak reporting will come at a later date. Okay, and Penny just put in the chat, as long as you're out of isolation, you can get vaccinated, including boosters after COVID. Thanks, Penny. There's a question from Lisa S. What are the days, hours for the Boulder County Fairground booster clinics? And Penny responded, Fairgrounds open every day for the next couple weeks from 8 a.m. to 6 p.m. and boosters are approved for everyone 12 and up. Thanks again, Penny. Question from Wendy P. A parent would like to test their child with a home PCR test. Do you know if this is reliable? So it's a great question. Often we get data on how well various tests perform under laboratory conditions, but we recognize that there is always room for user error when it comes to at-home tests. And that is something that's really hard to quantify because there aren't a whole lot of studies out there about how these tests perform at home under, again, unsupervised, unproctored conditions. So it's hard to say if it's reliable. At this point in time, I would say if a test is not expired, it comes back with a positive result, especially if that person is symptomatic, there is a good probability that is a true positive, and we should treat it as such. I think at this time, a home or positive on a home test, even in the absence of symptoms, is quite likely to also be a true positive, and we should treat it as such. Where it gets kind of dicey is negatives. When we get that negative result, when there are such high levels of COVID in the community, it's really hard to put as much weight on that negative and trust it as we can a positive. So I'd say, you know, if you've got someone, especially who's symptomatic, who's testing negative, including on an at-home test, it would be ideal for them to get retested, but we recognize that is kind of hard to come by these days. So that's why we're really looking at using symptoms as one of the most straightforward ways to determine who should and should not be in care. Okay, there was a question about mixing and matching boosters, and Penny said you can mix and match boosters. There's no formal recommendation for the mRNA vaccines. Whatever is available is fine. Okay, question from Abigail M. Can you give us a sense of the number of children under 5 that are hospitalized and how this compares to last year? A question that we are getting regularly from parents is how dangerous is Omicron to unvaccinated children under 5? We do not have that data. So like I mentioned before, rises in hospitalizations tend to trail, rise in cases by a couple weeks. So I really hope the state can provide us some data on local level hospitalizations. To date, they have not provided us with that data at the county level. We've been able to do some internal analyses, but I believe the team that can support those is completely underwater right now as well. So I can't make any promises about the availability of hospitalization data. I will say that nationwide, there is an uptick in hospitalizations with more children hospitalized with a COVID-19 diagnosis now than at any other point in the pandemic. However, a number of those kids are being admitted for reasons other than COVID and are just testing for positive for COVID while they're getting, a routine screening test at the hospital. So it's really tough to say at this point in time if a rise in hospitalizations is due to increased severity of the Omicron variant, or if it's just so many more kids are infected right now that results in a rise in the number of kids hospitalized and testing positive for COVID. I would say that messaging for how dangerous is it for kids under the age of 5, given that they are nearly completely unvaccinated, they are susceptible to severe COVID-19, including MIS-C, which would result in hospitalization and potentially death. Those severe outcomes are less likely to occur in children compared to adults, but they are not inevitable. And children with underlying chronic, so complex chronic, congenital, and cardiac conditions are much higher risk. And then even kids with obesity, asthma, diabetes, those kids are also at increased risk. So parents with kids under 5 who are unvaccinated should continue to take caution, especially if their child has some of those underlying chronic conditions. Question, do we need to report to the state if we have to close a class for a day? I don't want to speak on any requirements you might have for state reporting, but for COVID specific situations, you do not need to report to us if you have to close for a day. We're just asking you to report some basic information about who you know has tested positive or developed symptoms after a known exposure.
Elena, do you mind if we ask, I don't know if anybody from state licensing is here, because I'm wondering if that's what they were referring to. Who could answer that? All right, so I can look into that and send it out with the notes.
Great, thanks so much, Kara. How long, okay, moving on to Jamie or Jaime, how long is quarantine for household exposure? So quarantine is 5 days if an individual can wear a mask. It's a full 10 days if they are unable to wear a mask due to age or due to a masking exemption. And as we talked about earlier in this presentation, if that individual has ongoing contact with the COVID positive person in the house, they need to wait till the end of that person's isolation period before the child contact can start quarantine. But yes, just continue to email Health ECE when you know of household exposures and we'll walk you through it. Question from Verinda M. What if the home exposure is isolating away from the unvaccinated household members? Then if the unvaccinated or undervaccinated household contact, they would start day 0 of quarantine from the last date they had contact with the positive member. Comment from Abigail M, who was in support with our guidance of starting quarantine on day 10 of a household member's isolation. Thank you for your support. Some battles we had to accept defeat or compromise on. Okay, question from Goddard Louisville. If kids have to remove their mask for meals and naps, are they able to return? Great question, and I'm kind of following 2 different pathways depending on if they're returning from quarantine or isolation. So if they're returning from quarantine, meaning they were exposed, we do not have evidence that they are infected with COVID themselves. We can let them return and take their mask off for naps, for snacks. That's okay, because the risk is lower because that person is just coming back from quarantine. But we are much more strict when individuals are returning from isolation, meaning we knew that they were infected or ill, and we either had it confirmed as COVID or it was highly suspicious for COVID. Those are the situations when if they're returning early, we really need strict and correct masking compliance. And when they have to take their mask off, to be at least 12 feet away from others when they do remove it. Question from Linda A. No test required if exposed in the household setting. No, recommended on or after day 5 or sooner if symptoms develop, but BCPH is not requiring testing at any point for isolation or quarantine anymore. Annie H. If an individual tests positive and is completing their 10-day isolation period but has a negative test prior to the end of their isolation period, will this affect the timeline of when their isolation period would end, possibly shortening it? No. So no subsequent negative test can shorten a home isolation period once someone has tested positive. We've gone into this in office hours, but again, there's a number of reasons why someone could test positive, then could test negative, and that does not mean that it was a false positive. Question from Philly B. How do we communicate this to families who have received guidance now that will change after the 17th? We did include that language within the BCPH school and child care guidance. And so, to be frank, we're expecting parents to defer to that public facing webpage if they want to remain up to date on all of the current protocols that are happening in childcare.
Hi, Elena. Sorry.
Hi.
So I think my bigger concern, and I think Pamela, the other director at a location, our bigger concern is we're providing your beautiful graphics, your calculator, and that all changes like next week. And so do we reach out to those families and say, actually, that data gave you is, going to change, or how do we go? Because I have 21 cases and I don't want to send out 21 emails with new, like, oh, actually, never mind. Sorry, I'm wrong. Your quarantine's cut in half or whatever.
Yeah, absolutely. So what our team is doing is up until the 17th, we are just defaulting to that 10-day home isolation period. And from, 17th onward, we will then start defaulting to 7-day isolation. So we'll give you some leeway to figure out what makes sense for you. If you would rather just start implementing 10-day isolation now, connect with us, and I'll take this on rather than my teammates because I'm the one coming up with this offer. If you want to circle back and get 7-day dates, I'm happy to do that for you. But once we make that transition, we wouldn't necessarily recommend that people retroactively go back and shorten isolation. It would just be really tough. So when we're saying up until the 17th, we're saying people that were provided isolation guidance up until the 17th have their dates. And then from the 17th onward, that's when we'll start providing 7 days. But yeah, for your specific facility, if you just don't even want to go there and want to switch to 7 days sooner, just connect with Health UCE and I can help you out with some timelines.
Wouldn't it make more sense to do the change like 1st of February, not the middle of the month during the peak?
Yeah, I was not involved in the decision about the date that was made.
All right. Thank you, Elena.
Thank you for the feedback. Of course. Question from Jamie or Jaime. Can you review the quarantine timelines? Are there still options for 7, 10, 14-day quarantines? Nope, the CDC just let those go. Honestly, that's the honest response. So right now, quarantines are 5-day if you can mask, 10-day if you cannot mask. No 7 or 14-day options. Question from Emily, is the day 0 of contact quarantine starting in the positive household numbers day 5 of isolation true for K-12 as well? Yes, that is correct. We are in alignment with K-12 in that regard. Elizabeth, will you please put the links in the chat? I did go ahead and put the link to the BCPH School and Childcare public-facing webpage in the chat. Abigail M. Abigail, I'm just providing feedback about the shift to 7-day isolation by the 17th. I'm not privy to data that shows that children are shedding less data compared to, or I'm sorry, shedding less virus. You know, that decision, again, is kind of one of those policy decisions that have to be made to kind of meet the public halfway. And I know that might not settle too well with providers. And that's why we continue to allow you the leeway to stick with a 10-day isolation if you really feel most comfortable with that. So if shortening isolation to 7-day for children by the 17th is something that you are uncomfortable with at the facility level, you can retain 10-day. That is okay, but BCPH is shifting that minimum requirement down to 7 as an agency. Okay, so there's a question regarding CCAP. So I'll read this out loud, and I'm not sure if anyone's on the call who can speak to it. With the number of children missing school due to the increased levels of COVID, do you anticipate CCAP paying for additional absences?
Excuse me, I apologize. I see that from a couple of people, and I think I only tagged one person in my response that I typed. We are definitely exploring increasing absences. We cannot do so retroactively for January, unfortunately, but we will be sending something out by the end of January to let you know if we were able to do so for February.
Thanks so much, Jody. I appreciate that. Okay, question from Brenda M. For returning to work school after a positive COVID test, is a negative test required after the 5-day vaccinated or 10-day unvaccinated isolation period? Okay, so first thing I want to address is that the isolation period does not differ based on vaccine status. So only does quarantine periods differ by vaccine status. Positive is positive. Whether you're vaccinated, unvaccinated, whether you're symptomatic, non-symptomatic, a positive is a positive. And if you are younger or in a cohort that is younger than kindergarten or school aged, it's 10-day shifting to 7-day, or staff 5-day or 10-day with a mask. And no, a negative test is not required. BCPH is not requiring negative tests when it comes to quarantine or isolation. Andrea F, are we shortening the quarantine time to 7 days as well? No. So quarantine, again, is 5 days. If you can mask on days 6, 7, 8, 9, 10. If you cannot mask, quarantine is 10 days. If leadership or policy groups want to make any changes to that, I will circle back with you, but I'm not privy to anticipated changes at this time. Okay, so I realize that we're over time and I'm seeing a lot of questions still about timelines for isolation and quarantine. So I'm going to hold off on those because, you know, we did put those tables together. So hopefully, sorry, Jane, I'm putting you on the spot. Maybe we can send out these slides as soon as possible, so people can have these tables in hand. Yeah, that's really the most direct, you know, place that I can answer these questions for you. Thank you, Jane.
And we'll have the recording by today too, so we'll get them out. No problem.
Okay. Thank you.
And just to remind people, there is office hours tomorrow. So, you know, some of you who might be able to log in tomorrow from 4 to 5, Elena will, I'm sure, be able to go through some of those just to reiterate what has already been shared today.
Thank you, Jane.
Yeah, and I think some of them you've already answered. Masks, there is no specific requirement. And Mandy asked a question about PCR versus test. Antigens. Maybe just leave it at that one.
Yeah. So the only testing requirement that BCPH has out right now is in the context of return to learn, which is what you use for symptomatic folks with no known exposure to COVID-19. Yes, technically antigen tests, including at-home tests, are still acceptable in lieu of a PCR test, but please understand that at-home tests come with some unknown degree of user error, and there may also be reduced sensitivity with the Omicron variant. But from a policy perspective, we have not changed that.
Okay, then given the time, and I know, Elena, you are diligent about answering these questions, I'll go ahead. It looks like most of the other questions we've answered to some extent. I'll go ahead and stop the recording, and we'll get the information, the recording and notes and so forth out